Welcome to the second video in the cardiology series of the CCRN practice review. This is lifelong nursing, and feel free to pause the video, that way you can understand and have time to answer the question. Question 11. The patient you admitted earlier is now describing an episode of chest pain. Which of the following would most likely indicate coronary artery disease as the etiology? A. The pain is associated with nausea, extreme fatigue, and radiates to the right arm. B. The pain is burning, started after eating, and was relieved by an antacid. C. The pain is squeezing, radiated to the patient's back, and associated with shortness of breath. Or D. The pain is sharp, worse with deep inspiration, and relieved by turning to the side. Okay, the answer is C. The pain is squeezing, radiated to the patient's back, and associated with shortness of breath. This is because answer A does not describe pain from coronary artery disease, while answer B describes indigestion or acid reflux. And answer D describes pain from pericarditis, so that leaves the answer C. Question 12. Your patient has cardiogenic shock and subsequent cardiogenic pulmonary edema. Which of the following would be most effective for this patient? A ventricular assist device to increase coronary artery perfusion, a beta blocker to increase cardiac contractility, an alpha-adrenic drug to increase coronary artery perfusion, or D, an angiotensin-converting enzyme inhibitor to decrease afterload. And the answer is A, a ventricular assist device to increase coronary artery perfusion. This is because mechanical assist devices, such as a ventricular assist device or an IntraAortic balloon pump, will increase coronary artery perfusion in the setting of cardiogenic shock. Given an alpha-adrenic drug such as norepinephrine will constrict arteries, thus increasing the workload of the heart. A beta blocker will decrease the contractility, and reducing afterload will decrease the work of the heart, therefore decreasing the blood pressure and coronary artery perfusion. Question 13. A patient post-op day 1 from a AAA repair with a Dacon graft has a serum BUN and creatinine increase paired with a decrease in urine output. Which of the following is most likely the etiology? Acute renal failure, graft rejection, septic shock, or an acute hemorrhage? And the answer is A, acute renal failure. This is because in AAA repair surgery, there may be a prolonged decrease in the perfusion to the renal arteries. This results in damage to the renal tubules. The other choices are less common than the renal failure. Question 14. Your patient has a temporary transvenous VVI pacemaker with a set rate of 72 beats per minute and a milliamperage of 5. The monitor shows a 1-to-1 pacing at the set rate. The physician asks you to determine the capture threshold. Which of the following should you do? Slowly increase the sensitivity until the heart rate increases. Slowly decrease the sensitivity until the capture is lost. Slowly increase the milliamp output until native beats are seen. Or slowly decrease the milliamp output until the capture is lost. And the answer is D, slowly decrease the milliamp output until the capture is lost. This is because the capture threshold is assessed by decreasing and not increasing the milliamperage until the fascia spikes are seen without a QRS. This is the point where the capture is lost. The output is then set as about double the capture threshold. This may prevent the loss of capture even if a fibrinous crust grows over the surface of the electrode. The pacing or the sensing threshold is assessed by the adjusting of the sensitivity. Your patient with a history of heart failure and myocardial infarction presents following an episode of syncope. The assessment 2 hours later demonstrates a blood pressure of 134/65, a weak and thready heart rate of 115 beats per minute while supine. While sitting, the blood pressure shows 109/69 and a heart rate of 131. Respiratory rate is 32 and shallow. Urine output over the past 2 hours is 30 milliliters, while the patient has clear breath sounds. The patient most likely requires vasodilators, loop diuretics, IV fluids, or vasopressors? And the answer is C, IV fluids. The decrease in blood pressure from supine to sitting demonstrates orthostatic hypotension. Clear lung sounds and low urine are signs of hypovolemia. Vasodilators or diuretics will worsen the problem. Vasopressors will only further elevate the afterload and the systemic vascular resistance, increasing the workload of the heart. Question 16. While getting a 73-year-old male patient's history, the patient tells you that he has mitral stenosis. You would anticipate which of the following findings: systolic murmur, sinus bradycardia, a systolic murmur with atrial fibrillation, a diastolic murmur with atrial fibrillation, or a diastolic murmur with sinus bradycardia. And the answer is C, diastolic murmur with possible atrial fibrillation. This is because murmurs are caused from stenosis, which is when the valve is open. In this case, the mitral valve is open during diastolic phase, also known as the filling phase. Chronic resistance produced by the stenosis of the mitral valve will result in an enlarged left atrium, which in turn may lead to atrial fibrillation and not sinus bradycardia. During systole, the mitral valve would be closed. Therefore, only mitral valve regurgitation would cause a systolic murmur. Moving on to the next question. Your patient was admitted with an acute anterior wall myocardial infarction and suddenly develops a loud, wholly systolic murmur, loudest at the left sternal border, fifth intercostal space. Your patient also develops tachypnea and bibasilar crackles. Which of the following would provide the most definitive diagnosis of this problem? A decrease in cardiac output, B, increased oxygen saturation in the right ventricle and the pulmonary artery, C, central venous pressure, less pulmonary artery diastolic pressure, or D, decreased arterial saturation. And the answer is B, increased oxygen saturation in the pulmonary artery and the right ventricle. This is because this clinical picture describes a ventricular septal defect. The O2 saturation on the right side of the heart would be expected to be higher than normal if arterial blood from the left ventricle is shunted into the right ventricle. Question 18. The orientee nurse asks you, the preceptor nurse, how an IntraAortic balloon pump therapy will benefit the patient who was just admitted from the cardiac catheterization lab. Which of the following would be your best response? It will increase the patient's myocardial oxygen supply, or it will increase the coronary artery perfusion during systole, it will increase the patient's left ventricle filling volume, or D, it will increase the left ventricular diastolic pressure. And the answer is A, this will increase the patient's myocardial oxygen supply. When the intra-aortic balloon pump inflates during diastole, the coronary artery perfusion is increased, which increases the myocardial oxygen supply. This occurs during diastole, not systole. The balloon pump therapy does not increase the left ventricular filling volume and will not increase the left ventricular diastolic pressure. After several hours of use, the balloon pump will actually help to decrease the left ventricular diastolic pressure. Question 19. The patient has had an episode of chest pain at rest with ST elevation on the ECG. The patient's pain was relieved and the ST segments were normalized after administration of nitroglycerin sublingual. The patient most likely had A, stable angina, B, ST elevation myocardial infarction, C, Prince-Mittels or variant angina, or D, Whelan's syndrome. And the answer is C, Prince-Mittels or variant angina. This is because ST segment elevation that normalizes and chest pain that is relieved after administration of the nitroglycerin are indicative of Presmental's angina. Stable angina occurs with activity and is very predictable. A STEMI, otherwise known as an ST elevation MI, does not respond to nitroglycerin and does not normalize with ST segments or have complete pain relief. Whelan syndrome does not present with ST elevation, but rather a biphasic T wave specific to V1 and V2. Question 20. An 82-year-old male was admitted with sinus arrest. The cardiologist has recommended to the patient that he receive a permanent pacemaker. The patient, with a history of hypertension and type 2 diabetes, indicated he would not want a pacemaker, but rather let Mother Nature take its course. What would be the best approach for the nurse? Explain to the patient that he may die without the pacemaker. B. Explain the consequences of the decision to the family and advise them to persuade the patient. Explore the reason for the decision and provide information on the procedure. Or D. Advise the patient he will need a no CPR order to limit treatment without the pacemaker. And the answer is C. Explore the reason for the patient's decision and provide him with information about the procedure. This is because an assessment of why the patient made his decision will help the nurse better intervene, and providing information will better help the patient to make an informed decision. Attempting to motivate the patient with fear or using family to influence his decision may cause problems in the future, even if the patient agrees to the procedure. That completes this video in the cardiology series. Please stay tuned to video 3 in cardiology, and remember to always learn everything you can. If you liked, please subscribe, and thanks for watching.